of health. A very good evening and hearty welcome to all on the fifth day of the Health Fest. I, Gayatri Arunachalam, take the privilege in comparing Health Fest 2K22, organized by DORAI Foundation in collaboration with the Department of Nutrition, Food Service Management and Dietetics from Srimati Dev Kunwar Nanalal Bhatt, Vaishnav College for Women, Crumpet, and Indian Dietetics Association, Chennai chapter. Dengue and malaria are both endemic in South Asia and represent a major public health burden. Malaria is a life threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquito. It is preventable and curable. There are five parasite species that cause malaria in humans. In 2020, nearly half of the world's population was at risk of malaria. Children under 5 years of age are the most vulnerable group affected by malaria, whereas dengue is a mosquito borne viral infection that is common in warm tropical climates. Infection is caused by any one of four closely related dengue viruses, which is also called as serotypes, and these can lead to a wide spectrum of symptoms, including some which are extremely mild that are unnoticeable to those that may require medical intervention and hospitalization. In severe cases, fatalities can occur. Dengue epidemics tend to have seasonal patterns, with transmission often peaking during and after rainy seasons. There are several factors contributing to this increase, and they include high mosquito population levels, susceptibility to circulating serotypes, favorable air temperatures, precipitation, and humidity, all of which affect the reproduction and feeding patterns of mosquito, as well as the dengue virus incubation period. To apprehend more about dengue and malaria, we have Madam Sindhulata, registered dietitian, with us this evening. Ms. Sindhulata completed her post-graduation in food and nutrition from Women's Christian College in 2013. Ma'am cleared UGC NET and the registered UGC NET in 2013 and registered dietitian exam in 2018. Madam has acquired additional qualifications in critical care nutrition and completed many internships at various hospitals. She has also worked as a lecturer, clinical dietitian, and visiting dietitian at various hospitals in Chennai. It gives me immense pleasure to invite Ms. Sindhulata for today's scientific talk. Over to you, ma'am.
Thank you, Gayatri. Good evening, all. Am I audible?
Yes, ma'am.
Okay. Okay, can we start with the presentation then?
Irfana, please present.
Okay, ma'am.
Okay. So let us start with the presentation. So they have asked me to cover about nutrition in dengue and malaria. Okay, good. So this is on the higher rise in accordance with the COVID cases there in India. So I'll try to cover up the aspects that mostly they see in the hospital from the hospital side. Okay, so theory put into practice plays a major role. So I'll try to cover mostly from the hospital point of view. Okay, so let's start in the next slide, please. Okay, so these are the aspects which I'm going to cover. So what is a particular disease? May it be dengue or malaria? Then the prevalence, so how many people are affected in a particular population. Then the etiology, the cause of it. The pathophysiology. Pathophysiology will have the early diagnosis as well as the symptoms and clinical presentation. Before we go for the next part of it. So why are these important? The prevalence, etiology, pathophysiology, diagnosis, symptoms. So only if you know what has been lacked in your body or what has been affected in your body by which has lost a particular nutrient or which particular nutrient loss has gone for that particular infection. So all these needs to be looked upon before you guide a patient or guide any individual with your particular nutrition therapy or your so-called diet cap plan. So you need to know all these things for you to jump into the next thing. Similarly, how a doctor reads upon a patient's history or infection of it, their uh, their role in the human host cell, then they go about the treatment. So next stage it will be treatment, your medical nutrition therapy, and certain few frequently asked questions the patient asks us or any other a nutrition student or anyone they see, and a take home message, and if you have any queries I'll answer to it. So this is how I'll go about. Next please. Okay, I'll start with dengue. Okay, the first thing which any person would ask is the simple question whether it's dengue or dengue. Okay, so it is similar. It is either British English or an American accent which you need to follow. So which I will be following is dengue. Next. Okay, so what is dengue? It is an infectious viral disease. Why do you say an infectious? Because it can transmit from a person to person, or from an insect to a person, or from any other thing, say water or your food substances, spoiled food substances. That is why we term it as infectious. It gets transmitted easily. So it is an infectious viral disease, and it is being transmitted by our friendly mosquitoes. So which family and which genes I have mentioned over there, these are all theories. And there are four viruses. Why do we need to know about these four viruses? Because there are four stereotypes: dengue fever virus 1, 2, 3, and 4. Everything is completely a different stereotype. A person once affected with virus 1 can also be affected with virus 2. So that is why we need to know these stereotypes. Not gonna go into detail about it, just know about these things. And there are various species and types of mosquitoes. So the one which causes this dengue fever is your Aedes aegypti and your Aedes albopicus. So these two species are the ones which causes the dengue virus. And where does it commonly occur? Either in the tropical or subtropical climates. So before it can be put, or you can say in a particular endemic thing, but people used to travel nowadays, so it can be transmitted anywhere. Okay, so next please. Okay, so this particular slide will let you know about a pathogenesis, meaning how a virus or any antigen that enters into our body gets replicated and put into the bloodstream. So first thing, the green thing which you see is the virus, the antigen, which gets fused into the human host cell. So this is a endoplasmic reticulum. So the first thing happens is fusion. It gets into the host cell. It disassembles itself, meaning the viral RNA is being released from the fused part. Then it replicates, meaning multiplication happens, gets assembled with the nucleus, then maturation, and then release into the bloodstream. So all this particular pathogenesis, the fusion, disassembly, replication, assembly, or maturation of a particular virus, we call it as the incubation period. So if a mosquito bites an individual or a person, it's not that the next day you get these symptoms or you get affected by it. You'll get at least, it has to be waited for at least 3 another days for you to get a symptom. So the next slide. So as I told you, for dengue virus, it is 1 to 3 days. So all these things needs to undergo in the human host cell for a person to get a symptoms. So once the incubation period is over, there are 3 phases. So one is the febrile phase, the another one is the critical phase, and another one is the recovery phase. So these three phases can be seen in any dengue patient, but uh, we have good medical treatment or medical facilities available in worldwide nowadays. So people will get cured in the febrile phase itself, meaning the symptoms will be cured, everything will be fine. The reversal phase will happen and they get recovered, they go to home. So febrile phase is one, but there are chances for a patient to go into critical phase, meaning the next phase. Critical phase is little aversion state. Okay, so even that can be cured with the medical facilities available now, and then the recovery phase. Why do we also see the recovery phase? Because once in the recovery phase, if a person or the individual who has been attacked with the dengue fever, if he doesn't have a proper nutrition or if he doesn't follow the proper treatment advised by the doctor, there are chances for the person to get relapsed again. Okay, so that is why we need to see a recovery phase in any treatment for that matter. So let's go into the febrile phase now. Next slide, please. Okay, so as I told you, the incubation period of dengue fever is 1 to 3 days. You cannot see any symptoms, but the fever starts from the day 4. And any fever for that matter, or any infection that happens in our body, a week time will be there. Would have seen many dialogues in even in cinemas. Fever vanda at least 7 nalukum, cold vanda 7 nalukum. The virus will stay there in our body for these many days. So that is why the next line where it states lasts for 3 to 7 days. Okay, so what are the symptoms that you can see? Let us start with the headache part. The left hand side, if you see, fever with any of the following symptoms. That can be headache meaning headache and eye pain. The retroorbital pain will be present. These the doctors will see particularly ask for inga pain irka, inga valikida, inga tondala purshamku. So they see particularly because they need to diagnose whether it is dengue or not. So headache meaning the retroorbital pain, a fever will be there. Muscle pain or myalgias, bone pain, joint pain, your arthralgias will be present. Rashes is very common in the first dengue fever. Okay, meaning the person who is affected with dengue for the first time. And severe presentation, they have nausea as well as vomiting. So nausea, vomiting can be either due to the dengue virus, or it can be due to the medications that can cause. Okay, so other severe presentation is any dengue fever will have the left hand side symptoms. But if it is not treated properly, or if the person or the individual is being affected with severe symptoms, they present all the things in the right hand side. So you can see lymphadenopathy, meaning the lymph nodes will be inflamed. So that is why they press here and check. Okay, weaker irkan papanga. So that is the lymph nodes will be inflamed. Another thing is your hepatomegaly, meaning the liver cells will be inflamed. Your liver will be bulged. And another thing is maculopapular rash. It will be worsened. You can see in the hands, everywhere in the body. Another thing is respiratory problems. Respiratory problems meaning that might be due to worsened state, meaning there will be low blood count, low platelets, everything will go. There will be fluid accumulation in the lungs, so breathing difficulty will be seen. Another thing is leukopenia. Leukopenia is where your white blood cell count will be lower. And thrombocytopenia, this is a trademark thing which can be seen in any dengue patients. Okay, so platelets will be normal count will be like say 1,50,000 to 4 lakhs. But if it goes less than 1,50,000, we can see at most lower than 4,000. I mean, sorry, 40,000, 60,000 and all. So in that case, it is a very, very severe. And next one is transaminitis. Transaminitis is already the liver is being affected. So there will be an elevation in the liver enzymes. You can find your AST and ALT, meaning your SGOT and SGPT. So these enzymes will be elevated. So if these two enzymes are elevated, we call it as transaminitis. Okay, next please. Okay, so with all the medical facilities and with proper nutrition, if the person is oblique with these two things, they can be cured or recovered. We can say recovered in the first phase itself. If not, they enter into the critical phase. So if you see the third point over there, I would return 3 to 7 days after your febrile phase. So that is one way where they can enter into the critical phase. Or if you see the first point, the secondary infection, meaning as I told you, there are 4 dengue viruses. So serotype 1, 2, 3, and 4. So a person who has already been affected with dengue virus 1, if that person is affected with dengue virus 2 within 18 months of time, they can have a critical phase. They are obliged to enter into a critical phase, one thing. Another thing is other comorbidities. So comorbid conditions meaning a person who is having other things like say diabetes, hypertension, who is having cardiac problems, respiratory problems, hepatic concerns. So if a person who's having all these comorbid conditions and also is affected by dengue virus, then they are likely to enter into the critical phase because our body is interconnected. So if one thing is being compromised, other things are obliged to compromise. So next thing is what they can see in critical phase is thrombocytopenia. As I told you, the platelet count will be reduced to very worsened states, 40,000, 60,000. So there will be no clotting factor that occurs in the body because your platelet will help in the clotting. So there is a increased risk of bleeding. Okay, so I have heard people or I have listened to few people say that even if they brush their teeth, they will get bleeding. Then the gums get bleed. So that worsened state is what they end up with. So that particular thing, that particular condition is called as dengue hemorrhagic fever. Okay, so if the person's thrombocytopenia goes down, if there is a bleeding seen, then they diagnose it as dengue hemorrhagic fever. Next thing is there will be vascular leakage. As I told you, as we have seen the pathogenesis, anything it happens in the endoreticulum or in any cells of the body wherein the endothelial cells are the strong one. This particular things will be loosened, meaning it will be inflamed. So all the things that is present inside that endothelial cells will be leaked out. Okay, so you may it be fluids, may it be proteins, or may it be anything that is present inside the particular cell. So this will, if it has been released out, it can affect the kidney or it can affect anything by either increasing the BP or anything else. So that way they end up having shock. So this particular thing, they will diagnose it as dengue shock syndrome. Okay, but these two, dengue hemorrhagic fever and dengue shock syndrome, with proper medical facilities and other things, they do not enter it, but if it is entered, it may lead to death also. Next, please. Okay. So next is the recovery phase. So anyone who's been given, as I told you, proper treatment and nutrition, other stuffs, the recovery phase will be early. Okay. So resolution and stabilization. What is resolution and stabilization? Your thrombocytopenia, your platelet counts are down. So with treatment, with good food, it comes up high, it has been resolved. Another thing is your stabilization. As I told you, when the platelet counts are down, the blood volume will be down. Okay, your blood white, everything will be lower. So there is a hit with the hemodynamic status, meaning your BP, your everything, heart rate, everything will be lower. So if all these are being treated properly, everything will be stabilized. So that is the stabilization. And the third thing is you can again see the rashes during the recovery phase. So one needn't panic because a person is getting rashes after the dengue fever, because during the recovery phase, people will find rashes. Another thing is chronic fatigue. Obviously, a person who is having fever or who has had fever will have the pain or say utmost tiredness. That is a common thing during the recovery phase. So that is why we need to give proper nutrition during the recovery phase for them to replenish their stores and again turn to healthy individual. Okay, next one. Next, please. Okay. So how do they, a person or a doctor, it is always a doctor who does the medical diagnosis. So how do they diagnose this dengue fever or any other thing? One thing is they will check with the clinical signs. As I told you, fever, retroorbital pain, or nausea, vomiting, or rashes, all these, they will see the symptoms or the clinical signs, which you can see. Okay. Another thing is the travel history. So a particular person who has traveled to a particular endemic region where they are prone to dengue fever. Fine. Another thing is rule out other diseases. Okay, first they will see all the other symptoms. Okay, well, a malaria work, rule out all this. Okay, it's not malaria. Okay, some rashes is there. Okay, let us see the dengue thing. Next, they go for RT-PCR. and the serology test, wherein this particular anti-dengue immunoglobulin thing will be checked. If it is positive, then it is dengue fever. So that is how ruling out other diseases. Okay, in the fever illa, lastly in the symptoms la irukumbodhu, fine, it is then dengue fever. Okay, next one. Okay, see, this is common for anything, any fever or any other conditions. So factors that affect diseases severity and prognosis. So if a patient age largely matters, meaning a infant will have poor immunity status, so that infant is actually prone to get any kind of diseases or fever. Again, elderly again will not have proper immune functions, so they are prone to get any other diseases that is transmitted, meaning infectious diseases. Another one is pregnancy. Pregnancy women are again prone to get diseases. Another thing is your nutritional status. If a person is well nourished, then all the system in the body will function properly, so the person will not have any will have a proper immune system so that it fights against the diseases. But again, if there is protein energy malnutrition or any other, say, particular loss of nutrients which results in protein energy malnutrition, then the people are prone to get these diseases. Next is the ethnicity, particular social group. Okay. Next is sequence of infection with different dengue serotypes. As I told you, it depends. The serotypes, the dengue fever 1, 2, 3, and 4. So that is one thing. And virus genotype, its replication and its another thing. And quality and extent of available medical care. Obviously, if you see in rural areas or something like that, proper facilities are not available, proper diet care is not available, the recovery phase will be very, very late. Or sometimes they end up with having the hemorrhagic fever also shock, and they end up with death. Next, please. Okay. So the treatment. So treatment for any infectious diseases as of now for dengue as well as malaria, it is just the supportive, meaning they treat the symptoms and they by large reduce all the extent of severity. So one supportive therapy which they give is analgesics, fluid replacement, and complete bed rest. So if any person who's affected with dengue goes to hospital, this is the treatment which they give, particularly the fluid replacement. Okay, as I told you, the blood volume will come down, BP drops, that is actually very harmful. Next is aspirin, NSAIDs, and corticosteroids. No self-medication. No. One thing, why do I say no self-medication? Some people, if they have headache or if they have fever, they tend to take aspirin. Okay, so as I told you, there is a low platelet count and the risk of bleeding is very high. These things will have anticoagulation. It worsens the condition. So that is why no self-medication to avoid hemorrhage. Next is prevention. Prevention is where vaccines are available, but it is not fully effective. As we already seen, there are many stereotypes, so it is not fully effective. Next, please. Okay, now we enter into our major part is we see about medical nutrition therapy next. Okay, so before you go to a patient and explain the diet, okay, we would have studied the theory. Okay, dengue vandishna and the symptoms la irukum. We are supposed to give a high calorie, high protein, good fluid, good nutrition, everything. Yes, completely fine. That is the principle of diet for any dengue diseases, but you are supposed to do it on an individual basis in any hospitals or anything you do practically. Okay, so before that, you're supposed to know the history of the individual, of particular patient. You go and give advice. For example, as I told you, a doctor will get history from the patient and then he diagnoses and gives a treatment. Similarly, a dietitian goes to the patient, gets a history properly, then give them the diet care plan. He or she gives the diet care plan. So first thing is you're supposed to nutritionally assess the patient. Only then will you know whether he needs to be given a very high calorie or a high protein or particular loss of nutrients are there. So that will be assessed, and then only will you can say a diet care plan. So let's see what are these. First one is PMH. I've written as PMH is past medical history, past surgical history, and diagnosis. Okay, so these things will be collected by the doctor. It can be seen in the case file, or you can directly go and get the medical history and surgical history. Then have a talk with the doctor and ask about the diagnosis. So, what is past medical history? Meaning, as I told you, the person who has many other comorbidities are prone to be prone to end up with having critical phase and all. So, past medical history meaning if a person is having diabetes, if the carbohydrates are not being controlled, again it worsens the condition. Sugar levels go up high, it again has a very interconnection with the fever and other stuffs, meaning the recovery phase will be very very slow. And past surgical history, so particular surgeries, if particular for example gallbladder has been removed recently, then you're not supposed to give them a very high fat immediately. Slowly, yes, you can. So all these are supposed to be taken into consideration. And next is, as I've written, subjective objective assessment and plan and care. So this we say it as SOAP format of assessing a patient nutritional of the nutrition status. Or you can go for the last one, something called as subjective global assessment, which is widely accepted in any countries and in any hospitals. Okay, that has been validated and it has been given a certification to be used in any hospital for normal patients, whereas for cancer patients it is completely different. So let us see about the SOAP format. So SOAP format where you assess the patient subjectively. Subjective meaning you get information from the subject, meaning from the person. Okay, meaning if he has a normal appetite or a normal hunger patterns, or say if the patient is having, how does he pass the motion, whether it's constipated or loose stools or something like that. So that only if you get all this information will your diet care plan be proper. So if a person is having loose stools and you're supposed to give that patient a very high protein and you give them milk, then you actually worsen the symptom. So that is why you're supposed to take all the subjective details, your hunger, your appetite, your bowel movements, or your maturation pattern. Having a low blood volume, they can end up having very low urine output. So all these are interconnected. So this is one thing. Next is your objective pattern. Objective is where you can measure. So your height, your weight, the BMI of the individual, or you can see the MAC, TSF, all these can be assessed, and you can actually know the past nutrition status of the patient. Meaning, if the MSCs or the TSFs are very low, then there is poor somatic stores of protein and fat. So that is one thing. And if the BMI is not proper, then pattern of eating is very, very bad. Another thing is you can see the height to weight ratio. Sorry, BMI ratios, all these things. So all these will let you know the nutritional status of the individual in the past years. So another thing is clinical evaluation. Clinical evaluation, as I told you, the symptoms which you can clinically see. Okay, you put down the conjunctiva part over here. If that's very pale, it is termed as anemia. Again, nails, the blood has to rush off. Again, if it doesn't rush off, anemia. So all these can be seen clinically. You can see it. That is why we say clinical evaluation. Next is your assessment. Then you put up everything together and then you do your plan and care. Plan and care meaning the requirements, the principle of diet, the goal, and then your MNT. So, okay. Requirements meaning you give them this much amount of energy, this grams of protein, this grams of carbohydrate, this grams of fat, adukapro fluid, and all the other things. Okay. So, particular thing. For example, the day before session which you had, ma'am spoke about Wilson's disease. So, the copper has to be reduced. So likewise, particularly for in dengue patient, if there is anything that needs to be given extra or that needs to be lower, has to be mentioned. So that is how it works. So the requirements needs to be calculated. Then your principle of diet comes. So for example, a person is 160 centimeter, a female, and she weighs around 105 kgs. Okay, so if you go by the thumb rule, see, we give 20 kilocalories for obese, say morbid obese, then 25 kilocalories if they're overweight or obese, then we give normal 30 kilocalories per kg body weight. Or say a very high calorie, high protein, meaning we give up to 35 to 40 kilocalories. So if we see the principle of diet of a dengue patient, it is like high calorie and high protein from the book part. So if you give 35 kilocalories for 105 kilos, it ends up with 3000 to 4000 kilocalories. So is it actually ideal to give? It is not. So you're not supposed to put it common to every individual. Okay, so you're supposed to assess properly and then go for adjusted body weight, or give a very low calorie, because if you give high calorie for that particular patient, that obese patient, there is something called as thermic effect of foods, because your body needs to do all the other things for the food to digest. So it's again you're giving extra burden to your body. So again the fever might rise up, other things continues. Again, it's a vicious cycle. Next, please. So once you nutritionally assess the patient, okay, this patient is well nourished, malnourished, or severely malnourished, moderately malnourished, or severely malnourished. Because in SG, that is a pattern that will be put into scores, and we arise with whether the patient is well nourished, whether the patient is moderately malnourished, or whether the patient is severely malnourished. So depending on that, you put down the nutrition goals. So first thing, so as I told you, the blood volume will come down, and the supportive treatment in medical thing is the fluid replacement. So similarly, we are also supposed to see the fluid replacement, meaning the hydration matters. Any type of fluid can be given. One. Next is help support with increase in platelets. So the nutrients that help in improving the platelets are proteins, folate, iron, vitamin C, and vitamin D. Okay. Next is hemorrhage worsening. There is too much of leakage of blood, maybe through bleeding through nose, or vomiting, or in stools, or in urine. Anywhere the blood can be released out. So that way, to improve the platelet thing, vitamin K has a coagulation factor. So that needs to be included in the diet. And avoid worsening of symptoms. As I told you, if there is nausea and vomiting and diarrhea. Okay, so during diarrhea conditions, if you give them milk, the lactase enzyme is actually absent. So if you give them milk, again, it worsens the symptoms. So that needs to be taken into consideration. And nausea and vomiting. A person who is having nausea and vomiting will have aversion towards food. So if you give them a very fat-rich meal, again, they end up throwing up. So that is why you're supposed to avoid worsening of symptoms. Next is your immune boosters. Obviously, the immune system needs to function properly again, so that needs to be taken care. And tissue repair and cell rejuvenation. Why do I put this tissue repair? Because the endothelial cells are being might get disrupted. As I told you, it ends up in vascular leakage. So all these needs to be taken into consideration. So that requires a good calorie, protein, or a balanced diet. So a dietitian or a nutrition student, when they talk to a patient, or if they explain diet to anyone, should know what matters, meaning protein, folate, iron, vitamin C, vitamin D. Why do we give all these things? Only to increase the platelet. Any Tom, Dick, and Harry can go into Google, they can find out, okay, dengue na, I have to take தண்ணி நல்லா குடிக்கணும், proteins நல்லா சேர்த்துக்கணும். But they do not know the reason. The underlying reason a particular nutritionist or a dietitian needs to know before they go and explain it to a patient. Because any dietitian or that nutrition student is not smarter than a normal Google views. Next, also you are supposed to take the comorbidities into consideration, because as I told you, it's not a normal individual or a healthy individual who gets bitten by the mosquito and get dengue. It is also a diabetic patient. He's also a cardiac patient. He or she is also a liver patient who gets dengue. So their medical history also needs to be considered before you give them the diet. So nutrition goals must also include comorbidities. Next, please. Okay, so why do we give fluid? Because it regulates body temperature, regulates BP, improves platelets. So this is what a nutrition student or a dietitian needs to know before they go and explain it to the patient. The particular nutrient, what is the role in that particular disease? Okay, obviously, common thing, fluids up. If you drink nice water, your body temperature will be maintained. If you take oil, it's a lubrication. Yes, it is correct. But for that particular disease, what is the role? And is it different from the RDA? Obviously, normal எடுத்துக்கிறது வேற, and in particular, for example, a pregnant woman, the iron requirement will go up high. Okay, so similarly, you need to know whether it is different from the RDA, and the richest sources, also the lowest sources. Okay, So the fluid, it regulates the body temperature in this particular thing because the person is having fever. It regulates BP because the blood volume is low, the BP will be lowered, so it improves platelets, the blood volume will increase. So is it different from the RDA? Yes. Okay. So the common RDA is like drink 2 to 3 liters of water, 3 to 4 liters of water. So it's not like that. It depends on the body weight. Okay. We have something called as a holiday formula, wherein you put in there the first 10 kgs, the second 10 kgs. It is working for the pediatric as well as for the adults. One. And next thing is rich sources. There is nothing called as a rich sources. We give them plenty of fluids. Okay, so any fluids, as I mentioned, endococonut water, buttermilk, juice, rice, kanji, dal water, soups preferably. The last one, preferably the hypercaloric fluids, meaning I have mentioned something called as ONS, meaning oral nutrition supplements. See, I can understand people saying go for natural foods. Yes, completely fine. But during the febrile phase, if you are working in a hospital or something, during the febrile phases, the patient will have worsened effect of nausea and vomiting. If the person has worse nausea, vomiting, and the appetite will be very, very bad. So at that time, we are supposed to give them good fluids, also the energy to fight against the diseases, also for the medicines to work. If there is no proper nutrition, the medicines do not work in that particular individual. Okay, so that particular reason we take into considerations and we give them a good oral nutrition supplement for that particular disease as well as for the individual. Meaning if a person is having diabetic, you can also give them a diabetic formula. Okay, so that particular time you put it it is a scientific formula, we say, mix it up with water, ask them to drink, say every second hourly or say 4 times a day or something like that. We have many flavors, so it depends. Maybe they can take a liquid form, not a solid form. So that is why we say preferably hypercalorie fluids. So when it comes to our natural food, you can give them a fruit milkshake, or say you can put dates, nuts, everything into that one. Another thing is you can give them chicken soup. Okay, so add little amount of rice to it, mixed up in a jar, make it a little liquid, give them to it. So it is giving them carbohydrates, giving them calories, and you're giving them proteins also. Another thing is protein. It prevents anemia, it improves the platelet again, and prevents muscle wasting. As I told you, in the recovery phase, the person is very malnourished, the recovery phase is actually very, very slow. So proteinuria in children is found with dengue patients. So it depends on the individual again. It depends on the weight of the individual. So you needn't, if the person is well nourished, you needn't give them a high protein. You can give them a normal 1 gram per kg body weight, but the high biological value protein needs to be seen, meaning the one which has all the essential amino acids present in it. So the rich sources have been mentioned here. And next is again folate, which helps in improving platelet production. And is it different from the RDA? No. And the richest sources are, say, green leafy vegetables, broccoli, legs, legumes, papaya, and all. And iron. Iron, as it prevents anemia again, poor viral colonization, and prevents liver damage. Okay, see, the second one is ideal for this particular thing. If the red blood cell has good quantity of iron, then it doesn't allow the virus to colonize in it. So that is why we say have good amount of iron, and it prevents liver damage. Okay, and is it different from the RDA? No. Okay, as of now, there is no scientific evidence that it has to be given extra. The only thing is give them good amount of heme iron, that is good for absorption. And if at all you give a non-heme iron, you give them good amount of vitamin C. So the sources are mentioned there. Next, please. Okay. And the vitamin C, as I told you, it needs for the absorption of iron. Again, it increases WBC and platelets. As I see, is it different from RDA? No, but effective supplementation is needed for this thing to work. And richer sources also been mentioned as citrus, guava, amla, tomatoes, etc. And vitamin D, it controls dengue progression and dengue virus replication. So this is how you are supposed to go and explain it to a patient, or if any doctor asks you, only then they will actually accept you. Okay, and is it different from the RDA? Yes, but under controlled environment. As I told you, see 1,000 or 4,000 international units, but under controlled environment, these needs to be given, because there are studies which say vitamin D, if it is being given, it controls the dengue progression. So it is like it is stopping the transmission of diseases. Next is vitamin K. It is a clotting factor. So we give all these things. Is it different from the RDA? No. And vitamin A, immune enhancer, cell integrity, prevents endothelial damage. So all the endothelial cells, the endothelial cells will be, the integrity will be maintained. So that is why the rich sources have been mentioned here. So as I told you, high calorie, high protein, it is necessary? No, it is based on the particular individual or the patient. Okay, next. Okay, next are the FAQs. Next, please. Okay, so these are the questions which we get majorly from the patients. So can I take papaya leaves? Okay, see, you can take. There are scientific evidences available nowadays. It is available in the journals. They say if you take 30 ml of it 4 times a day, it is actually fine. It doesn't give a patient any toxic levels of it. So you can ask the patient, yes, you can, they may take, but provided it should be clean, it should be avoid of any diseases. You people know that even trees, leaves will have diseases. So it should be good, it should be clean, thoroughly clean, properly mashed it. The liquid portion can be taken and can be given to the individual. Again, why do they give papaya leaf? Only thing is it has antimicrobial, antiviral, it has a potent antioxidant values. So all these will help in platelet improving the platelet now thing. So that is why they ask papaya leaves. Yes, you can take. But if the papaya leaves are not void of any diseases, meaning if there is any problem present in that leaf, it may end up in patient in having diarrhea. Simple. Any food that is not good, patient ends up with diarrhea or vomiting or some problem with the stomach. Next, please. Can I take guava leaves? There, as of now, there is no scientific evidence to say that guava leaf will help in the treatment of or support the treatment of dengue. So, no. Next. Can I consume non-vegetarian foods? Yes, this is a major question which they ask for any fever or anything. Yes, they can consume, provided you're not asking them to have a very fat, fried or rich foods, I mean deep fried or say put into grilled or something. No. Anything that can be prepared bland and which is palatable, yes, they can. As I told you, chicken soup, something like that. Next. Or boiled egg or anything. And I have vomiting and diarrhea. I do not have any appetite to eat. What should I do? As I told you previously, the oral nutrition supplements can help at this point of time. But by large, it is the second option. You must actually help them have the natural foods. Next, ask them to get good amount of fluids, because vomiting and diarrhea will again reduce the water content in your body. How about many dietitians say or ask us to consume a normal diet? Isn't it wrong to have a load during fever? Olden days, we used to take only just rice kanji. See, that is a common thing which we get. எனக்கு உடம்புக்கு முடியல வரும் கஞ்சி மட்டும் கொடுங்க அரிசி கஞ்சி மட்டும் கொடுங்க. Yes, it is true. The concept is to have a very bland diet. So any balanced diet which is mechanically bland, mechanically soft, bland can be taken. So that is the concept. So when a person asks, if a person is having a boiled egg, yes, it is completely fine. Or an omelette, it is completely fine, provided don't put too much of pepper or chili powder to it. Next. Why do you ask me to take a small frequent meals when I do not have an appetite at all? Okay, this particular thing is, see, a person will get appetite or an urge to eat only if the patient eats. If a patient remains or if a patient starves, then it is sure that he will not have any appetite to eat. That is why we say have small frequent meals. And by a larger extent, it also helps in enhancing the immune function. Okay, so next. Okay, curd during fever. It is a common question. Yes, a person can have curd, and it is actually very good. It is a good probiotic, so helps in good, maintaining the gut flora. Okay, helps in digestion, assimilation, and whatnot. So, but make sure the temperature has been good, meaning freshly prepared curd, which is not kept inside the fridge. That is all. Next. Okay, so that is all with the dengue. So as I've said, as I've covered the pathogenesis, why the symptom occurs, and the treatment of diagnosis, treatment, and what the medical nutrition therapy needs to be given for a dengue patient with comorbidities, and the comorbidities also needs to be considered. Next is malaria. Okay, next. Okay, this is blah blah blah. I'll not read up everything. It is again caused by a mosquito, and we have 4 other parasites that cause mosquitoes that's been mentioned. And particularly, you're supposed to know is the female Anopheles mosquito. I hope you had been reading this from the 9th standard. So I'm not going into it. Next, please. Okay, so this is a picture representation. So it'll be easy, and it goes by seconds. So it is an infection caused by Plasmodium species. So this as a single cell parasite, the mosquito bites the individual. So once the Plasmodium enters into the bloodstream, it directly affects the liver cells and the blood cells. So it's like a cycle. If you can follow the arrows, it will be helpful. Okay, so this particular Plasmodium species, it will affect the red blood cells as well as the liver. So these are the particular things you're supposed to know. Only then you can help them with the diet. And causes a variety of symptoms which can lead to death also. But proper medical care facilities, then it is fine. Next, please. Okay, so where does it occurs? So you can see the malaria belt, okay, the one which has been a shading. So that particular region they are prone to get affected by malaria. Okay, meaning the Latin America, the African side, the South Asia, and the Southeast Asia. Next, please. Okay, so who gets affected by these? Young children under 5 years. No, Gayatri, when she started when she was comparing, she told you about all these things. So I'm not going into detail. It affects 5 years, pregnancy, the patient who has HIV and AIDS, meaning poor immune conditions, and travelers who has no exposure to malaria. Next. Okay, and this is one thing which something different from treatment. Sickle cell anemia is protective against malaria. Why do they say people who have sickle cell anemia are do not get malaria? So why? Because as I told you, it affects the liver cells as well as the red blood cells. A healthy red blood cell will have the Duffy antigen. If you see the one with the box, it has a receptor for the sporozoid to come and sit over it. Okay, whereas a sickle cell anemia will not, meaning the red blood cells are sickle shaped and they do not have the receptor for that particular parasite to go and place on it. So that is why a person who is having sickle cell anemia, there is we cannot say no way, but a very, very low chance of getting malaria. Next, please. Okay, so this is one thing which I saw. They say we have many WhatsApp forwards, or we have many Facebook reels or something like கொசு வந்து இங்க கடிச்சா காலையில வந்து முட்டிக்கு மேல பறக்காத கொசு வந்து மலேரியா கொடுக்கும். So that is just because it gets attracted. The female anopheles get attracts to the carbon dioxide which we breathe out, or the stinky feet odor which they say. So that is why they say it bites over here or the below knees part. Okay, and it mostly occurs during the evening throughout the night period. Next. Okay, so the one with the needle shape is called, we can see it's a Mosquito Proboscis, the mosquito's needle. Okay, so that green color thing inside that mosquito's needle. Okay, so these are sporozoids. Okay, it is from the salivary glands, it gets into the bloodstream. So once it enters into the bloodstream, it goes to the liver. Next, please. Okay, so as I told you, the incubation period for dengue we saw. Similarly, over the next 1 to 2 weeks, the incubation period happens, meaning it affects the hepatocytes. The liver cells will get affected. The host cells will get affected, but the sporozoids will be converted to merozoites here. Okay, so this is the phase where the liver functions will be decreased, meaning there is a compromise in the liver function. The detoxification or any other thing the liver does will be compromised. But you can see the 3 Plasmodium species that affect the liver cells, meaning over the 1 to 2 weeks. Falciparum, malaria, and now let's see. It is a falciparum that is extremely seen. The case is seen. Next, please. And the other 2 species, vivax and ovale, it goes dormant, meaning it will be present in the liver as hypnozoids. It can affect the patient later phases, meaning over months or to years also it is be present. So suddenly it will get activated. Okay, so the we cannot see any symptoms. The symptoms will occur only when it is activated. Okay, next please. Okay, so this happens in the not in the red blood cells, outside the red blood cells. So it is called as the exoerythrocytic phase. So it happens in the liver, not in the red blood cells. Next, please. Next. Okay. The merozoites are then released from the liver to the blood. Sorry, time up.
No, ma'am. Please continue, ma'am.
Okay. Okay, fine. So, okay, the merozoites are released from the liver to the blood cells. So, if you see, invades RBCs of all ages, meaning I'm talking about the RBCs age, meaning the reticulocytes, meaning the premature, the small RBC cells to the bigger ones. So, this two thing, Plasmodium ovale and Plasmodium falciparum, it affects the thing of all ages. Next. And next. Okay, so the vivax species, it invades only the reticulocytes, and the other two things will affect the older RBCs. So why do we need to know all these things? In the smear thing itself, it would have mentioned. On the smearல பார்த்தாலே you can understand that whether it's affected the younger thing or the older thing, or it has affected the all thing. So a doctor or anyone who reads that particular thing will know whether it's ovale falciparum, or if it is vivax, or if it is the other species that has been affected the patient. Next, please. Next. 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 Stop. Okay, so this is how it happens in the RBCs. So the merozoites enter into the RBCs. First the ring stage, then there is the growth. It is the early and the late phase. Then it digests on the hemoglobin part. Okay, so once it digests on the hemoglobin part, there will be a replication, and then there is a release. So that is why we can see low RBC count in malaria patients, meaning they end up having anemia. Okay, so next. Okay, so one thing is it continues the cycle. Once it gets ruptured, it again affects another RBC, the cycle continues. Or in the early tropozoite, it undergoes another thing called as gametogamy, and it forms gametocytes. Next, please. You can see the mosquito again sucking the blood of that individual who has these gametocytes, and the cycle again continues. This female Anopheles goes and bites another person, malaria. Now the cycle continues. Next. So this is what happens. So as I told you, the incubation period, mostly it is these two things which can be seen. Falciparum, it takes a few days for it to get incubated, and malaria, a few weeks. Okay, so what happens? There will be a short outburst of fever. You can see, there are something called as high-grade fever with continuous chills, something like that. But here it is short outbursts of fever, a small time, but it is very high. The temperature will be very high. There will be chills, rigors, and all. So that is just because the immune system is being doing its role. It's fighting against the antigen. So there is a release of alpha tumor necrosis factor and inflammatory cytokines, and there is a rupture of RBC, which you saw. So all these will end up a person having a fever. Okay, next. And another thing is there is hemolytic anemia, meaning there will be destruction of RBCs. The RBCs will be passed on to the spleen. So that is where the RBCs get destroyed. So most of the Plasmodium species will be identified by the by the spleen, meaning the infected RBCs will be identified by the spleen, and it will be destroyed. Okay, so when it is being destroyed, there will be extreme fatigue, there will be headache, jaundice will be there, and splenomegaly. That is just because when there is low RBC count, there will be increase in the bilirubin levels. So that is why they end up having jaundice, meaning hemolytic anemia will increase of the bilirubin levels. Next. Okay, so another thing this falciparum species does is it has this sticky protein thing. The left hand side top, if you see the RBCs, you can see that spot thing. So these are something called as knobs. It attracts other RBCs and it forms a clump, and it stops the blood flow further to other things, other side of the arteries. So they end up having ischemia to the other parts, meaning if it is stopped, the blood flow to the kidneys is being stopped, meaning the kidney functions will be compromised, or your brain function will be compromised, or any other thing. So they end up having organ failure also. So that is how fatal malaria can lead to. Next, please. Next, next, and next. Okay, so if the person is affected, as I told you, the clump formed and it doesn't allow the blood to flow through brain, it results in cerebral malaria. And if it affects the liver, it's called as bullous malaria. And other organs, they end up having sepsis, and they will have its own clinical features, meaning their symptoms will have different. For example, it affects the lungs, breathing difficulty, pleural effusion, water accumulation in fluids. So all these happens. So these are also need to be considered whether a patient is affected in the, I mean, very severely for you to give a diet, because that liver compromise functions needs also to be considered. Next, please. Okay, these are the diagnoses. As I told you, smear test will let you know what and all it is. And there will be a thrombocytopenia, elevated lactate dehydrogenate. As I told you, hemolysis will increase up the bilirubin and also will elevate the this lactate dehydrogenate enzyme. And there will be normochromic normocytic anemia, meaning the size and the color will be normal, whereas the count alone will be down. Next. Okay, treatment. Next, next, and next. Okay, so treatment is, you would have known from the school, as I told you, there is a chemoprophylaxis program, okay, for this malaria patients. So it is usually given to kill the sporozoid before it affect the liver. So the first step, when it goes to the liver, that step itself, they stop it. Or it is a therapeutic treatment. Therapeutic treatment, when there is an active infection. So the incubation period is over and the patient is having fever, short outbursts of it, that is when you give this therapeutic treatment. Or the gametocidal treatment, meaning spread of diseases. As I told you, the gametocytes will be formed, so that will be stopped for it to infect another person. So that can be, these are the 3 treatments available. Another thing is, like, most uncomplicated cases resolve with treatment, but there is a relapse. Next, please. There is a recurrent malaria, meaning a recurrence. The treatment which they give is not does not clear the infection, meaning it has brought down the symptoms and other things, but the root cause is not being thrown off. Next is relapse, meaning, as I told you, there are 2 other species which are dormant in liver. So that can be activated in the later stage. So that is relapse. And reinfection is, whereas an individual is effectively treatment and that particular malaria has been gone, but some other species has affected them. So that particular thing we cannot think. So that is reinfection. Next. Now coming to the medical nutrition therapy. Next. Okay, so this is the same thing where I spoke before the dengue. You're supposed to nutritionally assess the patient before you give the diet plan for the malaria. So let's see about the malaria diet. Next. Okay, to restore iron, the iron deficiency anemia is seen. So you're supposed to give them iron to have a proper red blood cell, because the red blood cell will have it needs heme and myoglobin, meaning your iron and protein. So that is why you're supposed to give them iron-rich foods. And the third point, if you see protein, energy, malnutrition, that needs to be avoided, prevented. So manage pregnancy in malaria, and immune boosters, say A, C, E, and zinc, and tissue repair and cell rejuvenation. And again, you're supposed to see the comorbid conditions of any patient. So that also needs to be considered. Next, please. Okay. So why do you give iron for this particular malaria patient, and is it different from RDA and rich sources? So iron, it prevents anemia, it prevents cell damage, ischemia, and organ failure in case of malaria. So is it different from the RDA? It is not known. So there is no scientific evidence by large available for you to say, okay, it needs to be taken above the RDA levels. It can meet up the RDA levels more than enough. But the heme and non-heme iron matters. If you give the heme iron, it is best. But there are conditions where the people is vegetarian. We can only give them, vegetarian, we can only give them non-heme. provided you give them proper vitamin C for it to get absorbed. So richest sources have been mentioned here. Again, protein. As I told you, RBC, for it to produce, you need iron as well as protein. So protein prevents anemia. It prevents muscle wasting. Short outbursts of fever and the patient who has malaria are tend to end up having protein energy malnutrition, meaning most of muscle wasting and other thing. So during this period, if you give a proper protein in the diet as well as calories, there will be prevention of this wasting thing and helps in production of RBCs. So how much do you need to give? It again, it depends on the individual whether you're supposed to give the high calorie protein, high protein diet, meaning 1.2 gram per kg body weight, or if the patient is well nourished, he's having only to prevent, you can give them 1 gram protein with proper high biological value. Next is vitamin A. It reduces the incidence of Plasmodium falciparum. So all these, it's particularly related to malaria. And fluid, again, it regulates the body temperature, regulates BP and improves the platelet. So again, yes, with the body weight, you're supposed to calculate and let them. Again, if the patient is having nausea and vomiting, you can give them oral nutrition supplement only to replenish them. Okay, you're not actually giving something harmful. It is okay to give them. Next, please. And again, vitamin A. It reduces the impact of malaria on children's growth and protects pregnant women against malaria. So that is why there are many prophylaxis programs available with vitamin A. And again, is it different? Not known. And the richest sources have been mentioned. And vitamin D, it activates enzymes in T and B lymphocytes, which can help in fighting malaria. So again, is it different from the RDA? No. But vitamin D, when it comes to vitamin D, it's a sunshine vitamin. So for you, if you have to explain it with the diet, then you can go for egg yolk or fortified cereals or milk, because the government has come up a program with fortifying milk with vitamin D. And zinc and phosphorus. Anything, it's not only zinc and phosphorus, any minerals and trace elements, if you take, all these are they have a major role as cofactor or a coenzyme, meaning it helps in the activation of certain enzymes, say glycolysis or any other cycle. So all these needs to be given in proper, meaning a balanced nutrition has to be given for them to actually take up the calorie and protein thing. So what are the richest sources? I've also mentioned garlic, legumes, nuts, whole grains, dairy, chicken, seafood, nuts, soybeans, or the phosphorus thing. And again, if we take malaria, is it needed to give a high calorie and high protein? No, it again depends on the individual. See their obese conditions, see their morbid conditions, whether they're diabetic, hypertensive, or compromised lung function. Even compromised lung function, you're supposed to give them a high carbohydrate. They end up having worsened breathing difficulty thing. So that is why you're supposed to see the condition and come up with the principle of diet. Okay, and when you give them a good protein, you're supposed to give them good calories. Okay, if you're compromising much on calories, then the protein will be used up for the calorie purposes. So that is why we say normal calorie and a protein, or depending on the individual, you give them what amount of calories that needs to be planned. Next. Okay, so the frequently asked questions in malaria, there are not much. Only thing which I had got is having, can we take non-vegetarian foods? Yes, of course. Can we have curd? Yes, of course. And can we have juices? Yes, no problem. Provided you don't take it from the fridge. Everything has to be prepared fresh. Okay, so the take-home message here is any condition, any medical condition for that matter, you are supposed to nutritionally assess the patient or individual before you give them a diet care plan. So diet care plan, it includes the principle of diet. You are supposed to first calculate the dietary requirements, supposed to see the food preferences also. As I told you, vegetarian, non-vegetarian, a person is allergic to foods. Okay, so for example, for dengue patient, they get rashes. But if they're not allergic to brinjal, they can take brinjal. But if they're allergic to brinjal, don't give them, it worsens the condition. Next is the diet consistency. As I told you, bland, the texture of the food, everything matters. A person who's having a very worsened state of nausea, vomiting, diarrhea, giving them a bland diet actually helps. Then you can later improve it. The consistency can be improved, or the liquid form to solid form, that also can be improved. Next is follow up. As I told you, in the recovery phase, if you do not follow up them, then there are more chances where they can end up again having the infection, meaning they can end up having fever again. If they are malnourished, the immune system is again lower, they end up having other infections. So that is why follow up is very, very, very important. Next. As I told you, there are no much FAQs. Next. Thank you. So if there's any questions, I would be happy to answer. No, I cannot hear you, Gayatri. You're mute.
Thank you, ma'am.
Yeah,
Curiosity is the wick in the candle of learning. Ma'am, shall we have question and answer session?
please.
Participants, you can drop your questions in the chat box. Ma'am, I want to ask one question, ma'am.
Yes.
Whether in fever can be controlled by taking fluids alone?
See, fluid is one of the nutrient which helps in regulation of body temperature. Okay, that is not the only nutrient that will reverse. See, fever is, as I told you, there is inflammation or there is some reaction that happens in the body, meaning our body is fighting against something. So if you do not give them the proper calorie, protein, and other nutrients, it is you can end up having you can actually worsen the symptoms. So that is why fluid alone doesn't help. Fluid with proper balanced nutrition helps. If you take a book or if you go meet a patient, as I told you, give them good food, give them egg. It gives good proteins. It improves the say immune functions, meaning all the other WBCs and other things. So give them good food. Fluid alone will not help. No.
Okay, ma'am, that was the question, ma'am.
Okay, no problem. See, I
Thank you,
wouldn't have
ma'am.
covered, say, having calorie, protein, carbohydrate, or say one thing, mean the percentage is not being covered because it largely depends on the individual. Okay, so if a person is diabetic, they can go for 55 percentage of total calories. So it depends on the individual. This malaria and dengue is a condition, infectious disease. So the comorbid needs to be considered for them to give the percentage of other nutrients. Okay, fine.
Thank you, ma'am.
Sure.
Thank you, ma'am, for telling us about the incubation period and then how the nutritional assessment should be done and the medical nutrition therapy about the diet care plan. Gratitude is when memory is stored in the heart and not the mind. On behalf of DORAI Foundation and from the Department of Nutrition, Food Service Management and Dietetics, Srimati Dev Kunwar Nanalal Bhatt, Vaishnav College for Women, Crumpet, I express my sincere thanks to our speaker of the evening, Madam Sindhulata R.D. Thank you, ma'am, for sharing your valuable time with us. I thank all the spectators for their presence. And last but not the least, I thank the technical team for the support. Dear participants, stay tuned with us to connect with the next interesting scientific talk on nutrition in eczema by Ms. Jasmine Beryl Lydia, public health nutritionist, on 20th January 2022. Don't miss to explore fun-filled quiz activity on today's topic, nutrition in dengue and malaria.